Do you dread growing older? Do you have beliefs about aging that it's common to be depressed or it's common to have dementia? Today I want to talk about 5 common myths that we all have heard or even believe, and talk about what's real and what's not about aging, especially when it comes to mental health. I'm Dr. Regina Koepp. I'm a board-certified clinical psychologist and I specialize with older adults. All right, number 1, myth or fact? Depression and anxiety are normal with aging. The answer, myth. Depression and anxiety are not typical with aging and actually benefit from mental health care. Sadly, depression and anxiety often go undetected and untreated among older adults because of this false belief that with age it's normal to be depressed or it's normal to be anxious when it's not. So the bottom line here is, if you hear or see older adults struggling with mental health, encourage them to connect to their primary care provider to rule out any medical things that are causing these symptoms, and then connect them to mental health care. It can really make a difference. Number 2, myth or fact? Dementia is inevitable as we age. Answer, myth. Dementia is not a normal part of aging. So how common is dementia? According to the Alzheimer's Association, only 1 in 9 adults 65 and older has Alzheimer's disease. Here's the thing, Alzheimer's disease is the most common form of dementia, which is often why people use those terms, dementia and Alzheimer's disease, interchangeably. So this is another one where if you are noticing signs of cognitive changes in thinking, changes in memory, changes in functioning, it's really important that you help the older adult get to their primary care provider to rule out anything medically that's going on that could be causing these changes before you assume that it's dementia. Dementia is a serious medical condition and needs to be assessed and diagnosed and treated as such. Number 3, myth or fact? As we age, we don't need as much sleep. The answer, myth. As we age, experts agree that we need 7 to 8 hours of sleep a night, and some experts even say 7 to 9 hours of sleep a night. Sleep is critical for our brain health, physical health, and emotional health. So it's really important that we're getting a good night's sleep. So changes do occur with age in older adulthood, like maybe they're not sleeping as deeply, or they have sleep interruptions that they didn't have at other times in their life, like maybe they need to use the bathroom more frequently throughout the night, or have pain, or other conditions, caregiving, that interrupt sleep and interfere with getting a good night's sleep. There's some great tips that you can employ to help you get a good night's sleep, and so I encourage you to check them out wherever you're watching this video. Number 4, let's talk about sex, baby. Myth or fact? Sex and intimacy are no longer important after a certain age. The answer, myth. There was a recent survey of more than 1,000 adults between the ages of 65 and 80. And the survey found that close to 51% of men and close to 31% of women report being sexually active. The challenge is that we have a lot of stereotypes about aging and sexual health, and those stereotypes impact older adults, and those stereotypes show up even in healthcare systems. So the survey also looked at how often are older adults having a conversation with their primary care provider about sexual health. The majority of times older adults are not having these conversations. Actually, less than 20% of the time are they having these conversations. And when they do have the conversation, the older adult is the one most likely to bring it up. There are many benefits to sexuality while aging, including cognitive health and physical health, emotional and spiritual health, relationships, and so much more. If you'd like to learn more about aging and sexual health, check out some resources wherever you're watching this video. And finally, number 5, myth or fact? Addiction is not an issue that commonly affects older adults. The answer, myth. Addiction does impact older adults. In fact, in the past 20 years, alcohol use is on the rise among older adults, especially among women. Recent research also found that 11% of people 65 and older currently binge drink. So binge drinking is having 5 or more drinks in a sitting for men, or 4 or more drinks in one sitting for women. Outside of alcohol use, we also know that there are more opioid use disorders among older adults, and also cannabis use is on the rise. If older adults are struggling with a substance use disorder, the good news is that treatment is highly effective for for older adults. In fact, research shows that treatment, it can be even more effective for older adults than younger age groups. So some researchers found that after a year of completing substance use treatment, older adults were more likely to have maintained sobriety. So that's good news. So why is it important that you pay attention to myths as it relates to aging and mental health? So if we continue to believe the myths that addiction's not a problem for older adults, or that it's normal to have depression, anxiety, or dementia as we age, or that it's normal to have sleep problems, then we're not going to be stepping in, expressing concerns to the older adults that we care about, and helping them connect to care. And when older adults don't get connected to care, when older adults don't get the mental health care that they need, all sorts of negative things happen for them and their loved ones. For example, medical problems get worse. The use of medications for those medical problems increase. Hospitalizations increase. Visits to the ER increase. Length of stays at the hospital increase. Those all have the impact of affecting caregivers and the older adult, but it creates more family strain. It costs more money, so more financial strain, and it increases the risk for suicide. So the good news is we can do something about it by shifting how you think about aging, by shifting what you know about aging, and by helping older adults to connect to care when you see something going on. That can make a big difference. Learn more at the resources wherever you're watching this video, and thank you for being here and doing your part.